the human race produces more waste than it really should.
We only recycle 9% of all plastic. That means that unless it's been burnt, every single piece of plastic ever made still exists on our planet.
The consumer has to be the one that forces everyone's hand to say, I will not buy from you unless you have a sustainability policy and a clear transparency on the whole supply chain of the product that I'm buying.
Never compromise. What you're doing today will have an impact on the planet for thousands and thousands of years.
Cataract surgery is the most widely performed surgery in the world. A single cataract surgery in the United Kingdom emits 132 kilograms of carbon dioxide equivalents. Extrapolating this value to a global scale, cataract surgery would generate 14.5 megatons of carbon dioxide equivalents every year. To put this into perspective, if current United Kingdom exemplar practice were followed worldwide, over the next decade, cataract surgery alone would create annual greenhouse gas emissions similar to entire countries such as Kenya, Croatia, or Sri Lanka.
Hi, this is David Chang from the United States. I co-chair a task force with members from AAO, ASCRS, and the Ophthalmology ASC Society in the U.S. Looking at OR waste. Last year we conducted a survey. We had more than 1,300 surgeons and nurses respond, and 90% are concerned about global warming. 97% feel that our OR waste is excessive. The survey showed that the number one cause is a combination of our surgical manufacturers who mandate single use. The liability is an issue, partly also perhaps for profit. And then we have overly stringent regulations that take away any surgeon discretion over what can be safely reused. We should look for ways to reduce the carbon footprint of our surgeries and to reuse things.
More than half of these emissions originate from largely disposable medical supplies. Aravind Eye Hospital delivers eye care to over 4 million outpatients and performs over 500,000 surgeries every year. The postoperative infection and complication rates are equivalent to or better than Western standards. For every one phaco surgery, Aravind generates only 0.25 kilograms of waste compared to 2.25 kilograms generated in the United States. If compared to driving a car, one phaco surgery in the United Kingdom leads to emissions equivalent to driving a car for 500 kilometers, while at Aravind, emissions are equivalent to driving the same car for 25 kilometers. At Aravind, our practices are aligned with our goal of responsible consumption. All pharmaceuticals, including antibacterial eye drops, local anesthetics, and balanced salt solution, are used on multiple patients until the bottle is empty or until the end of the operating day. The phaco cassette and tubing, which are usually discarded after every surgery in the West, are instead used for the entire surgical day. Gloves are rinsed between cases with chlorhexidine or alcohol. The surgical team's caps, masks, gowns, and sandals, as well as the patient's blanket, are laundered at the end of the day by the Central Sterile Supply Department, or CSSD, team. Our surgical system uses largely reusable instruments and materials, which means that a majority of Aravind's life cycle environmental emissions occur in the sterilization process. Stainless steel instruments, syringes, cannulas, blades, and phaco tools that come in contact with the patient's eye are removed from the operating room after every case, washed by hand in reverse osmosis water, and sterilized in a 30-minute flash autoclave cycle. These autoclaved items can be reused in the operating room on the same day. At the end of the operating day, these instruments are washed by hand, sterilized via ultrasound, and autoclaved for a full 1-hour cycle in the CSSD. After they have dried, the instruments are stored for use on the next operating day. The backbone of waste management at Aravind Eye Care System is how waste is segregated at the source. The practice of segregating even tiny bits of plastic, paper, and metal generated during the surgery, according to designated international waste management guidelines, has become almost muscle memory to our staff.
இந்த பிளாஸ்டிக் பேப்பர் தனித்தனியாக பிரிக்கிறதுனால நாங்கள் ப்ராக்டிஸ் பண்ணியாச்சு. இது ரொம்ப ஈஸியாக இருக்குது. இந்த சிஸ்டம் பண்ணுறதுனால நாங்கள் ரொம்ப டைம் சேவ் பண்ணுறோம். இந்த சிஸ்டம் எங்களுக்கு ரொம்ப பிடிச்சிருக்கு.
All of the OR's segregated waste goes to the waste disposal room, where it is either sent for incineration or recycling based on type. As 1/3 of waste is biomedical, it is sent to the biomedical waste disposal plant near Pondicherry. The remaining 2/3 is typically recyclable and is collected by vendors. Plastic waste is converted into small plastic pellets that are later recycled into plastic utensils, thus creating a sustainable and eco-friendly environment. In the same way, paper waste is also effectively recycled. Some paper waste is upcycled into decorative items such as jewelry and flower art.
We in the so-called wealthier nations have to look to our colleagues in low to middle income countries who are already doing a better job of resource conservation. And I think we can learn how to be more sustainable in this way. Our task force is working with industry and collaborating on ways to lower the carbon footprint. We're trying to work with some of the regulatory agencies, even the FDA, in terms of reusing things like drugs. And finally, we have the backing of our societies, so hopefully we can make some progress.
The greatest threat to our planet is our belief that someone else will save it. Rather, each individual and system should try to leave the Earth a better place than how we found it. At Aravind, our efforts are centered on not just providing affordable eye care to all, but doing so while creating environmentally sustainable and efficient systems. At the end of the day, the Earth is what we all have in common.